Hello, my name is Isma Shaib, an assistant professor in Cairo University, and today I'm going to show you a case of positive force duction test for the lateral rectus and superior oblique muscle in a case of third nerve palsy. The main importance for the force duction test is to differentiate between the cases of paralytic and restrictive strabismus. The main concept of a force duction test is to stretch the muscle and then move the globe in a direction that is opposite to the direction of action of that muscle, and then see if you have restriction or the globe is moving freely. So here we have the globe. This is the superior rectus muscle, the lateral rectus muscle, the medial rectus muscle, the inferior rectus muscle, the inferior oblique, and the superior oblique. Let's see how can we do a force duction test for the recti, and starting with the lateral rectus as an example. To do a force duction test, first we have to know that the lateral rectus originates from the orbit posteriorly, and then it goes to be inserted at the sclera anteriorly. And to stretch this muscle, we will pull the globe forwards or anteriorly, and then move it in a direction that is opposite to the direction of action of the lateral rectus muscle, and see if we have restriction or not. If the muscle is tight and the movement of the globe is restricted, then we have a positive force duction test. But if the globe moves freely, then you have a negative force duction test, which is the normal state. And now let's move to the case. And to do the force duction test for the oblique muscles, we will have to remember that they have a course that goes from anterior to posterior, and then it will be attached to the sclera. So in order to stretch these muscles, we will have to do retropulsion by holding the globe from the nasal limbus and then move the globe towards this side. And to do a force duction test for the inferior oblique, we will rotate the globe just like that, and for the superior oblique muscle, we will rotate the globe just like this and see if we have restriction or not. And now let's move to the case. Here you have a tip that you have to do in order to hold the globe properly in the case of force duction test or for any other purpose. It's by holding the globe from the limbus. And why specifically from the limbus? It's because it's the site at which the conjunctiva becomes tightly adherent to the cornea. And so when you hold the globe from this side, you will have a very good grip and then move the globe properly. If you hold the globe from the conjunctiva is really loose and you can't move the globe. So today we understood the concept of a force duction test, and we saw a case of negative and positive force duction test. And thanks a lot for watching.